Hi and welcome back. Now we're in the somatic symptom and related disorders. This is part 2. And again, I'll come up with a little scenario here. Casey is a 30-year-old man who was very afraid he might die of cancer, as his mom had several years ago. He made frequent visits to different doctors complaining of a pain in his left leg. He began checking for lumps in his leg several times a day and reading about cancer on the internet, and he went to the emergency room complaining of pain in the leg, thinking that this was a sure sign of a tumor and it was growing. After conducting several tests, the doctors found nothing wrong with his leg and reported that he was in excellent physical condition. After a year without a diagnosis, Casey found that he was experiencing chest pains in addition to the pains in his left leg. He went to the emergency room 3 times, certain he was dying of a vicious cancer that had now spread to his lungs. Each time the doctors assured him that his pains might be real, but they could not find any physical cause. Casey decided the doctors were simply not competent enough to find the disease, and he became increasingly frustrated and began to stay at home as much as he could to learn about his perceived condition and to chat with other cancer patients on Facebook and MSN. His relationship with his family and friends had become strained, and he's becoming increasingly socially isolated. In somatic symptom disorders, there are physical complaints that cannot be accounted for by organic causes. Thus, the symptoms are theorized to reflect psychological rather than organic factors. Overly preoccupied with their health or body appearance, no identifiable medical condition causing the physical complaints. To help you maybe get this, the word somatic, it's derived from the Greek word soma, meaning body. Thus, these disorders are related to symptoms of one's body with no organic explanation for the symptoms. Examples that we will look at include conversion disorder, illness anxiety disorder, somatic symptom disorder, and factitious disorder. And we're going to start with conversion disorder. It was also known as functional neurological symptom disorder. In conversion disorder, symptoms or deficits in voluntary motor or sensory functions occur, which suggests an underlying physical disorder. But again, no apparent medical basis for the condition can be found. Now, the symptoms are not intentionally produced, and that's an important variable, as is with many disorders, is that these are not intentional. The person is not malingering. The physical symptoms usually come on suddenly in stressful situations, and these symptoms can include patterns of paralysis, epilepsy or seizures, problems in coordination, blindness, loss of hearing or smell, or loss of feeling of a limb. Now, this would no doubt concern you, but the person with the conversion disorder, they seem and appear unaffected. This is known as la belle indifférence, the beautiful indifference. You have something like you can't see. That would cause you some problem if you had been seeing all along and then all of a sudden you couldn't see anything. But to them, it doesn't seem to bother them. Illness anxiety disorder, on the other hand, is a preoccupation with the fear of having or the belief that one has some serious medical illness, but no medical bias or basis for the complaints can be found, and the fears of illness persist despite medical reassurances. Now, there's more than one type. One type is the care avoidant subtype. It applies to people who postpone or avoid medical visits or lab tests because of high levels of anxiety about what might be discovered. The second subtype is called care-seeking subtype, and it describes people who go doctor shopping in the hope of finding the one medical professional who might confirm their worst fears. Now, in some of these disorders, under somatic and conversion disorder, dissociative, you can ask the question, is this fake or real? And it's probably one from an unexperienced or inexperienced person looking into the circumstance that it must be, you can't be real. Well, people with illness anxiety disorder, they don't consciously fake their symptoms, but fear their symptoms are due to real illness. Feeling resentful towards their own doctor, they often go doctor shopping, and this condition is what was known as hypochondria. If we look at somatic symptoms disorder, people with somatic symptom disorders have trouble troubling physical symptoms, and they are excessively concerned about their symptoms to the extent that it affects their thoughts, feelings, behaviors in everyday life. The symptoms may include such complaints as gastric or stomach distress, and various aches and pains around their bodies. Somatic symptom disorder usually begins in adolescence or in a young adulthood and appears to be a lifelong disorder involving major disability. The next one we'll look at is what's known as factitious disorder. And the factitious disorder is a type of psychological disorder characterized by the intentional fabrication of psychological or physical symptoms with no apparent gain. Now, there's two subtypes of this as well. One is known as factitious disorder on self, which is characterized by faking or inducing symptoms on yourself. The second is known as factitious disorder imposed on another, and it's characterized by inducing symptoms in other people. Now, the first type, it used to be known, and you may have heard this term, Munchausen syndrome. The second time was known as Munchausen by proxy syndrome. So let's try to understand some of the perspective about where might or how we might explain the disorders. And we'll start with the psychodynamic view that holds that conversion disorder represents the conversion into physical symptoms of the leftover emotion or energy that is cut off from unacceptable or threatening impulse that the ego has prevented from reaching, that awareness, so it's pushed it down. And so to compensate, conversion theory, disorder. Now the symptom is functional. It might not serve them, but the symptom allows the person to achieve both primary and secondary gains. Well, let's determine what those are. Well, primary gains, in a psychodynamic theory, the relief from anxiety obtained through the development of a neurotic system. Now, alternatively, the secondary gains are the side benefits associated with the neuroses or other disorders, such as expressions of sympathy and increased attention that come from other people, and the release from ordinary responsibilities. You don't have to do this. If you're feeling that bad, you go lie down. And that's the secondary gains. Now, learning theorists, they focus on the reinforcement of, and the associations with conversion disorders, such as the reinforcing effects of adopting what is known as the sick role. Now, in sociology, they use the term sick role to say that if one is sick, one should accept the sick role, which means you be appropriately sick. If you can't go to school, you don't go to school, but then you don't go to the movies too. So sick role is you be sick. You stay home, you look after yourself, you eat correctly, you sleep, you rest, you get better. Now, a learning theory view likens illness anxiety disorder to an obsessive compulsive behavior. The cognitive factors in illness anxiety disorder include self-handicapping strategies and cognitive distortions. Now, the distortions can be affected with the cognitive theorists who look to the role of these distorted thinking patterns they can often be oversimplifying as making mountains out of molehills, as an example. Now, people may exaggerate the importance of the symptoms and produce excessive anxiety about their well-being. So that can lead us to a sort of a quick overview of what might be some treatments for somatic symptom and related disorders. The psychoanalysis, well, they seek to uncover and bring to the level of awareness these unconscious conflicts originating out of our childhood that are believed to be the root of the problem. Now, once the conflict is uncovered and worked through, the hysterical symptom should disappear because it's no longer needed as a partial solution to the underlying conflict because it's been resolved. The behavioral approaches, they focus on removing the source of the reinforcement that is maintaining this abnormal behavior pattern. Behavior therapists may also work more directly to help people with somatic symptoms and related disorders learn to handle stressful or anxiety-arousing situations much more effectively, thus avoiding the need to produce somatic symptoms. Now, biologically, antidepressants, especially the SSRIs like Prozac and Paxil, are having limited success. But like in a lot of these treatments, it'll be a combination of using some medication and some other form of talk, thinking, behavioral. Together will make the best outcomes. All right, there's the end of dissociative disorders and somatic symptoms related disorders. Sorry about that. So I hope everything's going well for you. Good luck, and we'll see you next week. Bye now.